Hello, fellow cat lovers, and welcome back to our channel. We all adore our feline friends, and their health is our top priority. Today, we're diving into a serious topic, some of the lesser-known but truly scary diseases that can affect our cats. Now, this isn't to frighten you, but to empower you. Knowledge is the best tool we have to protect our furry family members. So, grab a cup of tea, give your cat a gentle pat, and let's get informed together. First on our list is feline infectious peritonitis, or FIP. This one is particularly heartbreaking because it's caused by a very common virus, the feline coronavirus. Now, don't panic. Most cats who get feline coronavirus only experience mild diarrhea or show no symptoms at all, but in a small, unfortunate percentage of cats, the virus mutates and becomes FIP. It's like a villain's origin story happening inside their little bodies. There are two forms of FIP, wet and dry. The wet form is more common and progresses rapidly. You might notice your cat's abdomen swelling up like a balloon. This is due to fluid buildup, a condition called ascites. They might also have difficulty breathing if the fluid collects in their chest. Other signs include a persistent fever that doesn't respond to antibiotics, loss of appetite, and extreme lethargy. They just lose that spark. The dry form is more insidious. It develops slower and its symptoms are vaguer. It causes inflammatory lesions to form around the blood vessels in a cat's organs, including the eyes, brain, liver, and kidneys. You might see changes in their eye color, wobbliness, or seizures if the brain is affected, or signs of kidney or liver failure. Because it's so subtle at first, diagnosis can be incredibly difficult. For years, a diagnosis of FIP was considered a death sentence. The prognosis was grim, and options were limited to palliative care. But here's a ray of hope. In recent years, groundbreaking antiviral treatments have emerged that have shown remarkable success in treating FIP. It's a complete game changer. While access and cost can still be hurdles, there are now active, supportive communities online dedicated to helping owners navigate this journey. The key takeaway here is that if your cat is showing these signs, especially a persistent fever and abdominal swelling, get to the vet immediately. Early and aggressive diagnosis is crucial to accessing these life-saving treatments. Next, let's talk about cytozoonosis, also known as bobcat fever. This one sounds like something out of a horror movie, and honestly, its effects can be just as terrifying. It's a parasitic disease transmitted by ticks, specifically the Lone Star tick. While it's most common in the south central and southeastern United States, with climate change, the range of these ticks is expanding. So even if you don't live in those areas, it's worth knowing about. When an infected tick bites a cat, it injects parasites into their bloodstream. These parasites then go on a rampage, reproducing rapidly and clogging up small blood vessels throughout the cat's body. This blockage prevents blood and oxygen from reaching vital organs, leading to catastrophic organ failure. The onset is frighteningly fast. One day your cat might be a little lethargic, and within a day or two they can become critically ill. Symptoms include a very high fever, severe lethargy, loss of appetite, difficulty breathing, and a jaundiced or yellowish appearance to their skin and gums. Sadly, without immediate and aggressive veterinary intervention, cytozoonosis is almost always fatal, often within just a few days of symptoms appearing. It's one of the deadliest infectious diseases a cat can get. So, what can we do? Prevention is everything. If your cat goes outdoors, even just in a catio or on a leash, they absolutely must be on a vet-approved, cat-safe flea and tick preventative. Not all products are created equal, and some dog products are highly toxic to cats, so please, consult your vet for the best option. Regular tick checks are also a must. Run your hands all over your cat's body every time they come inside, paying close attention to the head, neck, ears, and between their toes. If you find a tick, remove it promptly and properly. Protecting your cat from bobcat fever means protecting them from ticks. Moving on to another serious condition, feline aortic thromboembolism, or FATE. This is not an infectious disease, but a sudden and devastating event often linked to underlying heart disease, particularly hypertrophic cardiomyopathy, or HCM, which is the most common heart condition in cats. In cats with HCM, the heart muscle thickens, making it harder for the heart to pump blood effectively. This can lead to the formation of a blood clot inside the heart. Fate occurs when a piece of this clot breaks off, travels through the aorta, and gets lodged where the artery splits to supply blood to the hind legs. This is called a saddle thrombus. It acts like a dam, abruptly cutting off all blood flow to the back legs. The result is sudden, excruciating pain and paralysis. The cat may cry out, collapse, and drag its hind legs. The affected legs will feel cold to the touch, and the paw pads may look pale or bluish. It is an absolute veterinary emergency. The prognosis for Fate is guarded to poor. Even with treatment to dissolve the clot and manage pain, many cats suffer from permanent damage, and the risk of another clot forming is very high because the underlying heart disease is still there. The most heartbreaking part for many owners is witnessing the intense pain their beloved pet is in. Because Fate is often the first sign of a serious heart problem, it highlights the importance of routine wellness exams. During a checkup, your vet might detect a heart murmur or an irregular heartbeat, which could be the first clue that your cat has underlying heart disease. Early detection of HCM allows for management with medication, which can help reduce the risk of clot formation and events like Fate. So, please, don't skip those annual vet visits. They could uncover a silent killer before it strikes. Finally, let's discuss chronic kidney disease, or CKD. Now, you might think, I've heard of that, it's common in older cats. And you're right. But what makes it scary is how silently it creeps up. Cats are masters at hiding illness, and by the time we see obvious signs of kidney disease, they may have already lost up to 75% of their kidney function. That's a staggering amount. The kidneys are amazing organs, responsible for filtering waste from the blood, managing blood pressure, and regulating hydration. As they fail, toxins build up in the body, making the cat feel progressively worse. The earliest signs are very subtle: drinking more water and urinating more frequently. You might notice you're filling the water bowl more often or scooping larger clumps from the litter box. This happens because the damaged kidneys can no longer concentrate urine effectively. As the disease progresses, you'll see more pronounced symptoms: weight loss, poor coat quality, loss of appetite, vomiting, lethargy, and a chemical-like smell on their breath. It's a slow decline that can be devastating to watch. While there is no cure for CKD, the good news is that with early detection and management, we can significantly extend a cat's life and, more importantly, their quality of life. Management often involves a multi-pronged approach. A therapeutic prescription diet, low in phosphorus and high-quality protein, is the cornerstone of treatment. Medications to manage blood pressure, control nausea, and address anemia might also be needed. Subcutaneous fluids, which you can learn to give at home, can help with hydration and make your cat feel much better. The key is catching it early. Annual vet visits, including blood work and urine tests, especially for cats over 7 years old, are absolutely vital. These tests can detect changes in kidney function long before your cat even feels sick, giving you a crucial head start on treatment. I know this was a heavy topic, but being a responsible and loving cat parent means being prepared for the worst while hoping for the best. By understanding these threats, FIP, cytozenosis, Fate, and CKD, we can be more vigilant. Watch for subtle changes in your cat's behavior, appetite, or litter box habits. Never skip those annual vet checkups, and always talk to your vet about preventative care like tick control. You are your cat's #1 advocate. Thank you so much for watching and for caring so deeply about the health of your feline companions. If you found this information helpful, please give this video a thumbs up and consider subscribing to our channel for more essential cat care tips. Hit that notification bell so you never miss an update. Stay safe and give your kitties an extra hug from me. We'll see you in the next video.